I recently attended an insurance conference in Las Vegas called Medicarians. It was a conference that focused on all things health insurance, Medicare, and employee benefits. I recently released a video talking about a couple key takeaways from the Medicare space from that conference. However, there's just so much information that I did learn that I wanted to make another video talking about some other key takeaways from the conference. And even being in the industry for 8 years, there's always changes happening and politics get involved, new laws, new regulations. And even though I consider myself a veteran and an expert at this point and have personally helped over 1,000 people and businesses with their health insurance, Medicare, and employee benefits, I still like going to these conferences to expand my mind, step out of my comfort zone, and stay up to date on all of said changes. So this video will be talking about a couple other key takeaways from the insurance conference I recently went to, and these key takeaways will be related to the Medicare space. One statistic in particular that stood out to me from the conference was that there are actually 10 million people right now who are considered working seniors in the United States. And well, what is a senior? They classify that as somebody over age 65. Again, 10 million are currently working who are over age 65. And that's relevant to our space, my industry, because once you turn 65, you have the option to go on to Medicare. And for those that don't know, Medicare is the federally run government program for health insurance, mostly for those over age 65. And to hear that there are 10 million people who are eligible for that, but not necessarily taking it, is shocking. Now, obviously, some of those 10 million people are taking Medicare, but there is a vast number of people who are not. And there's a lot of intricacies that go along with that. And I want to touch on some of the ins and outs and the consequences of being a senior and not taking Medicare. So first, let's talk about it from an employer side, so the business owner side, right? As a business owner, a lot of people don't know this, but line item number 2 for most businesses, the second largest expense for businesses is usually health insurance. And number 1 is usually salary, compensation for your workers. So not too far away from salary is health insurance in terms of expenses for businesses, especially as you get older. For those businesses that have many employees who are creeping up to that senior age or even past the senior age, that is a big expense. The older we get, typically, the more expensive our health insurance is, with the exception of once you're on Medicare. Medicare, because it's federally funded and because we all pay into it for the majority of our lives, our working lives, you see the funds come out every paycheck that says it helps pay for Medicare. That type of health insurance is typically cheaper than, say, an employer group plan, through a major insurance company, because there's already been a lot of the costs that have been paid into the Medicare program, so that by the time you are age 65, it is often much, much lower in terms of a monthly cost for the consumer and thus the employer to get on to Medicare rather than to continue on a group plan. So a lot of these employers, what they could do is actually save a lot of money by encouraging and pushing some of their employees off of their traditional group health plan that they have through their company, and instead getting them to go onto the full Medicare program that the employee has already helped paid into, for many years. And so from an employer perspective, they could save a lot of money instead of having to help pay for the costs of that particular senior for that employee who is on their group plan. The company, the employer, should educate the consumer and explain to them that, hey, the costs for you right now on our health plan for our company, it's costing both of us $400 a month. In total, it's $800 a month. But if you get on the Medicare, you might just have to pay $185 a month or something like that. And so there's missing education piece for a lot of these employers, a lot of these companies, a lot of the American businesses that have seniors working for them. Not everyone, of course, depends on the group plan, but a vast majority of these working seniors, if they are on their company health insurance plan still, they should definitely do a cost analysis to see if they could save some money by jumping on to full Medicare, the government program. And something that I've found after doing this for about 8 years now and looking through these employer health insurance plan options and comparing it to Medicare and the plan options for these seniors if they went on to the Medicare program and the private Medicare options, one, the costs are a lot cheaper, 9.5 times out of 10, 95% of the time, the costs are cheaper. Again, saving both the employer and the employee money. But not only does it help save you money, the coverage itself is actually usually a lot better. Medicare coverage is actually very good compared to most of the group plans. I mean, you're talking deductibles in the under $2,000 for Medicare, max out of pockets usually around $4,000 sometimes for different plans. There's different types of Medicare options, but compare that to a traditional group plan that someone might have through their job, and with those plans, a lot of times you're looking at $9,000 out of pockets, $5,000 deductibles. I mean, the cost savings is there all around, which also includes having better coverage 9 times out of 10 by leaving your employer company plan and going on to Medicare if you have that option. So if you're over age 65, it's definitely worth sitting down with your business, with the HR at your company. And a lot of times, sad to say it, they're not familiar with the government Medicare program, right? And so really what you ought to do, even anywhere close to age 65, if you're only a year away, or even if you're over age 65 and haven't had this conversation yet, find a local broker or find an independent insurance agent or agency that you can trust and who you're familiar with, and let them compare the costs. Let them take a look at your health plan that you have offered to your work and compare it to the price of different plan options available to you in your area for the Medicare plans. So that was one key takeaway from the insurance conference that I went to recently. And the other key takeaway also actually has to deal with costs and money, of course, just like everything. And that has to do with the rising costs of one of the 2 routes for Medicare. Just for the sake of this video, know that there are 2 avenues. There is Medicare Advantage and there is Original Medicare with a Medicare supplement and drug plan. So the Medicare Advantage program is basically privatized Medicare. It's still government funded, but those plans are actually seeing more funds being dumped into them by the federal government, and they are seeing a larger increase in terms of enrollments, and that is Medicare Advantage. But what the key takeaway from the insurance conference I was at recently was not talking about Medicare Advantage costs, but more talking about the traditional Medicare costs. Because with traditional Medicare, no one wants just traditional Medicare. I'll just get that out. There's a lot of reasons why, but long story short, you should not just have traditional Medicare. You would also need a drug plan as well as what's called a Medicare supplement, because traditional Medicare has a bunch of holes in it, and so you need a separate plan called a Medicare supplement plan to fill in the gaps, those out-of-pocket costs that leave you financially exposed with the original Medicare route. So again, not talking about Medicare Advantage. The conference key takeaway that I'm referring to is related to the rising costs of going with the traditional Medicare route. So a trend that was discussed very thoroughly at the conference was the rising costs of the plans to help fill in the gaps of original Medicare. It's already been seen across the country that the rate increases for these plans, when I was first offering these plans a few years back, they would be on average maybe 10%. Sometimes even I saw 4% rate increase. You still see that every once in a while now, but it's very, very rare. On average now, these Medicare supplement plans are increasing by 12, 15, even 20% in some areas of the country. And that is very scary for a lot of seniors, especially those who are on a fixed income. A lot of people around the country, once they turn 65 and stop working, their only source of income is Social Security. And newsflash, sometimes that can be very low. You might not even believe this, but a lot of clients of mine tell me that their Social Security income is less than $1,000 a month. Let's say you're even making $2,000 a month. That doesn't get you very far when you have to pay for the cost of Medicare. You have to pay for your Part B coverage. And then also now you have a Medicare supplement plan that's another $200 a month. And you also have to tack on a drug plan. And those drug plan premiums, the monthly costs for those plans, are also increasing at staggering rates. And, all said and done, someone that went the original Medicare route, they could easily be paying $350+ a month just to have their health insurance and prescription coverage. Not to mention that route doesn't even include dental and vision. So there's some staggering costs that are coming about that makes sense why a lot of people are going to the Medicare Advantage route, because a lot of seniors find themselves looking at the breakdown of the original traditional Medicare setup and filling in the gaps of that coverage. And they say, if I do that, I can't afford to eat at the end of the month. So that's why we're seeing Medicare Advantage become so popular, and why we're seeing the traditional cost of Medicare increasing, because just by default, the more people that go onto Medicare Advantage and who are opting out of the traditional Medicare program, there's a smaller pool for these insurance companies where if maybe they do have some high claim years, maybe they get really unlucky and they have 100,000 members get cancer and have to go through chemotherapy in 1 year. Well, guess what? They're not nonprofits, right? Insurance companies, they're making money, but they're also helping a lot of people, of course. In order to continue helping people and offering health insurance coverage to help fill in the gaps, they're going to have to raise their rates more and more, especially as we see the pools of people, the groups of people who are on the traditional Medicare, the average age getting older and older, and the health of the country just kind of going down. We're sicker than ever as a country, and so the smaller and more unhealthy that pool of people is, basic numbers, basic economics, the prices of that route are going to continue to skyrocket. So those were a couple key takeaways from the insurance conference that I recently attended. If you enjoy topics like this, if you like industry trends and staying up to date on information regarding the health insurance, Medicare, or employee benefit space, that's what we're here talking about. Give us a like, hit the subscribe button, follow us on your favorite social media platform. And of course, if you personally need help with this, please reach out. All of our contact information is in the description or comment section below, depending on the platform you're looking at. And again, my name's Colin Watsonville with Modern Health Solutions. Thanks for tuning in, and we'll see you soon.